Hi, it's a pleasure to introduce Aaron Bond. Aaron has worked with Northern Health for just over 20 years. His current position is executive lead of the Elder Program. This team provides leadership across a range of areas such as health services integration, human resources, information management, and resource allocation planning for services for the seniors population in Northern British Columbia. Thanks for joining us today, Aaron.
Oh, it's my pleasure. Thanks for having me.
It sounds like you have a really challenging, but I hope also rewarding position with all of those domains, and I'm sure there's others as well. Could you just expand a little bit on your job and the main responsibilities you have?
Yeah, it's not dull, and healthcare is not dull. That's for sure. Um, it's interesting because I've worked in healthcare, like you said, for just over 20 years, and a lot of it has been directly kind of in an operational role, whether running a hospital, or I worked a lot of years in mental health and substance use programs. And it's been the last several years that I've been in a regional strategic role, which for seniors care during COVID and that vulnerable population has been, you know, it's been an important role to get right, I think, just to make sure that we're supporting people safely as best that we can. So when it's not a pandemic, the role really is to provide strategic leadership and kind of from a clinical perspective as well, from a regional service network perspective, guidance to our clinical operational teams for kind of the span of services that we have for older adults and seniors in the north. So that's from long-term care, assisted living, adult day services, or home and community care programs. So looking at kind of how we provide service now and into the future, how we can continue to provide the service and keep people living at home for as long as possible. And so that's in a nutshell kind of what guides my day-to-day work.
Thank you. Okay, so jumping right in, can you tell me about some of the unique challenges facing senior populations in the North, maybe before the pandemic? And then, of course, we can add the little pandemic we've all heard of on top of those.
Yeah, Northern Health we're a large health authority. So we provide a full range of health services to just over 285,000 residents within our health authority. And it's just over 592,000 square kilometers. So it's a big, like the geography. Yeah, so it's a big geography. So that in itself poses challenges. It poses some really unique opportunities and a requirement to think out of the box and to be flexible. And we've learned a lot about, for example, how we can use virtual platforms for all the reasons that we've had to the last couple of years. But in a kind of such an expansive geography, that becomes even more important to embed in a service model. So I think there's the uniqueness of our geography and making sure that we provide equitable service to everybody living within our region. And so that's not an always easy thing to do, and it does pose challenges when you think about, you really want people to be able to live in their homes and in their own communities for as long as we can, and making sure we have services available kind of in each community, big and small, for that is a challenge. What it does though is that it forces us in a good way to work really collaboratively with community partners, with different organizations. A few that come to mind are First Nations Health Authority, BC Housing, all the nonprofit organizations that exist kind of throughout the north and throughout the province. So that's it's definitely, it's not dull, and it can be character building for all of us, I think. But I think that for our Northern Health region is definitely unique within BC anyway.
Right. So you've got this huge geography, you've got a lot of people needing different services in different communities. I imagine there's challenges with everyone having access to internet. So even just providing remote services, does everyone know how to use the internet? Are there good connections throughout all of those communities? And
Yeah.
then you add on COVID. So how did COVID complicate what is already a challenging situation, it sounds like?
Well, for a lot of people, and especially in BC, and I think like a lot of other jurisdictions, there was measures taken and appropriately to ensure people's safety, especially vulnerable populations. So like seniors and long-term care, assisted living, for example. And so while that was required, and there's limitations on visiting, for example, within those facilities. And again, we're not the only ones that made those decisions. It did kind of compound the impacts of people feeling isolated and feeling alone, and that's something that is difficult anyway. And really trying to ensure that there's that social connectedness exists. COVID underscored that challenge. So I think we did some of the things that other jurisdictions did, is really learn and had to push ourselves in terms of the virtual platforms available, both from a clinical sense and from a social connectedness sense for families and friends. So that, and it was just so long. And again, it's stating the obvious, but I think what made it more difficult in speaking with families and residents and our staff as well, working within long-term care and assisted living facilities, is that you never kind of knew when the end was coming.
Yeah,
That
indeed, we
makes
still
things
don't.
we still don't. Yeah, I mean, I think the good thing is that we've been able to open up for visitation in those facilities, and I think what makes it kind of difficult when I think about kind of policy and strategy and kind of how to move that forward within a health authority, it becomes difficult when you're just focused on getting through kind of a crisis day to day. Now, COVID doesn't it's only been here for a few years. We've learned a lot about it. So, but I think that geographic expanse and keeping people connected appropriately, I think is something that we paid attention to before, and we will in the future for sure.
Well, you've highlighted some important challenges, and we all know that Canada's population is aging.
Yeah.
And we also have a human resource challenge already, and a resource challenge, at least here in Ontario. I assume it's similar over there.
It is.
So what do you think in terms of how can we best plan to support this increasingly aging population, given these demographic challenges and the human resource challenges that we're facing as a country?
Yeah. And I wish I had more answers for that.
These are big. No one
that I
knows the
feel-
answer. No one
I
knows.
know, I know, but it's something. Well, you've nailed it. And when I look at northern BC, our 75 and over population will kind of surpass our 65 and over population the next several years. So, for all the reasons why you just stated, it is just so important that we not only understand what we're going to provide, what we're going to need for service for that, but understand how can we keep up from a human resource perspective. Because you're right, we certainly are challenged with that now, and it's in kind of some professions are more pronounced than others, but I'd say it's across the board where we really do have a challenge. BC has done, like the Ministry of Health in BC has done some, I think, well, I don't know how unique they are kind of across the country, but care aides, for example, are such an integral part of the service model for long-term care and home support. And there's a program called Health Career Access Program, which is essentially kind of paid training for the care aide profession with return of service agreements on the other side of that. So it's one example of trying to recruit people to a profession that it's a rewarding profession, but it's difficult. And so that recruitment and retention strategy, I think, is a big piece to pay attention to. I think as well, every opportunity that we can think of to give people kind of career laddering opportunities, I think is important. Not everybody will want that, but we've been talking about that within our health authority, and I know kind of at the provincial level as well, opportunities to kind of get people into a career path and then to every extent kind of grow and be able to progress the ladder in that. And those opportunities don't always exist right now. So I think that's an important piece of the workforce. And I don't know, I probably have more questions than answers, because on any given day, we feels like we're just kind of at the precipice sometimes of being able to sustain some resource, and somehow we pull it off. But it's stressful some days, I know, for the people that are running programs and facilities. So yeah, but I don't think we're not alone in that. It's an issue that I think we're facing demographically, kind of definitely across the country.
Absolutely. No, it's such a pressing issue everywhere right now. Have you seen or been part of any innovative solutions that you might want to expand on in terms of support for an older population that you've seen have been successful, and maybe something we could learn from over here in Ontario?
Yeah, you guys have some pretty amazing programs there. I can reference one though. So we've done a lot of modeling work over the past several years to take a look, at our aging population, and then what, from a service demand, what are we going to do? And so of course, you look at what do you need for increased long-term care beds, and we realized really quickly that if that's all we focused on, and this probably stating the obvious, but we had to go through the exercise, is if all we did is increase long-term care beds, we'd need way too many. And it's a place where not a lot of people want to go. It's a required service to have. But our strategy really is trying to put in services in the community as much as we can to make sure that we can support people in their communities. So things like home support, things like connecting with community agencies to support people to live at home for transportation, grocery shopping, etc. One thing that we have done is we're trialing actually in a couple different communities some alternative dementia housing. So it's kind of a hybrid between, it's not long-term care and it's not assisted living. And the eligibility criteria kind of fall in the middle. So mild to moderate dementia, somewhat physically able, but a 24/7 staffing model, and really a model that is working with people and engaging them in their care. And the meals are influenced by if the people living there, what do they like to eat, and having them help prepare them. So a lot of the things that I think kind of the more cutting edge progressive long-term care facilities are doing, but it's not the norm, unfortunately. And so for us, we have two examples of doing that in smaller communities, where really the goal is to keep people that are from those communities able to live there and not go into kind of institutionalized care if they don't need to. So they're smaller facilities. One of them's 8 beds, one of them will be 10 to 12 beds, but we think there's such an important alternative for us here. So I think it's one example of what we're actively doing.
That's really interesting to hear about, because I really feel like we need innovation in order to figure out a better way forward. So that's something I'll encourage the students to look into. So I guess I just want to know if you have any final suggestions that we might not have covered. This is a health policy class that you'd like people going into health policy or other healthcare roles to think about for improving healthcare or other services for older populations, and also considering the North in particular. Is there anything we haven't kind of gone over that you think is important for them to know? Or keeping in mind?
Yeah, but probably nothing that you wouldn't talk about already. But I think, for for the reasons that we need policies, they're very important, because there's a strategy and planning that occurs from that, and you know, flowing of funding, etc. I think one thing that has really been front and center for me for a few different reasons the last little bit is doing everything we can to make sure that, like, the people that are accessing service are influencing the policy discussion. So families and residents and patients, you know, depending on the service area. So, you know, when I think of my career over the years, that's always been important, but it hasn't always been upfront and early enough. And it's not always an easy discussion to have, and it makes things a little bit messier. And I think, but I think that's important, especially in healthcare, where the whole point is to care for our population. And so really understanding what's important to the people that live in your jurisdiction, I just can't underscore that enough. And because if you don't do that, it won't work. You know, like you'll implement services that just won't hit the mark for people. So I think that's a really important piece. And but to be intentional about that and include that in strategy and include that in work plans, because if you, it just kind of, it can't just be a ticky box, you know. And so you just, like, really embedding that, I think is just so key. Yeah.
I think that's a really, really important message. And there's been a lot of issues we've looked at in this class where policymakers did not consult end users, and it ended up backfiring. And you'd think they wouldn't make that mistake. But I think sometimes people are just so rushed and want a quick solution to a problem, and then unintended consequences often.
Yeah.
So
Yeah.
thanks.
No,
Yeah.
I think you're right. And the reality of it is it takes time, but I think I don't know. I think without doing that, it's a miss. So that's my opinion, and probably one of my hard learnings as well. Yeah.
Well, thank you so much for your time today, Aaron. It was really great to chat with you and to learn a little bit about your experiences and insights.
Yeah, no, of course. Thanks for offering to have this discussion.
Take care.
Okay, see ya. Thanks.